Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, key government officials once again skip the Senate probe on the alleged state-sponsored sugar smuggling. Also, the Senate resumes session, and among its priorities, the proposed Maharlika Investment Fund and wage hike. Also, over 4,000 motorcycle accidents recorded in the country since January. How can the government ensure the safety of motorcycle riders, passengers, and pedestrians? Senate Deputy Majority Leader J.V. Ejercito joins us live. The country has recorded over 4,000 motorcycle crashes in the first 4 months of the year, according to the Philippine National Police Highway Patrol Group. A transport advocacy group highlighted the need to focus on road design and updated policies to ensure the safety of both riders and the public. Let's go straight to the source of the story. We have Senate Deputy Majority Leader J.V. Ejercito. Senator, good to see you again.
Yes, good morning, Pinky.
Thank you for guesting. It's been a while, sir. You are a motorcycle advocate, right?
Yes,
So let's talk about this. Is this alarming? The PNP Highway Patrol group saying over 4,000, I think to be exact, it was 4,029 accidents from January to April, the first 4 months of 2023. And I just want to put into context that apparently the year before, the number of accidents reached 8,000 for the whole year. So is this alarming to you?
Yes, Pinky, it is indeed alarming, and I'm quite surprised that the first 4 months recorded already 4,000 accidents as compared to 8,000 for the whole year last year. And I'm hoping, I have a bill actually, but that didn't pass during the 78th Congress, and I refiled it again, that seeks to have mandatory riders education before someone is allowed to be able to purchase a motorcycle. Dapat bago siya bumili, he has to undergo trainings and seminars.
Is this the Public Utility Motorcycles Act?
That's different. That's for the
Okay.
motorcycle taxis and couriers.
So that you refiled this?
Yes, I refiled this in this Congress. But talking about the motorcycle taxis and courier services, you'll be surprised that based on their statistics, their accident rate is below 1%. No, it's 0.0. So because of all of this, yung Grab, Lala Move, Angkas,
yeah,
they undergo training.
Yeah.
And I can also observe that when in intersections, they are more disciplined compared to other riders. So that I think that's I would really pursue that. It's the importance of you can see the importance of having riders education before anybody is allowed to purchase a motorcycle.
Good, riders education. But isn't that supposed to come with better roads? Because, you have advocates blaming poor road designs or even defects on the road. I drive, and kahit ako na nasa motor vehicle, iniiwasan mo yung mga lubak, yung mga manhole na nakausli, yung mga hindi pantay-pantay na pag-asfalto ng kalye. So here's the point, sir. Kung motor sila, and I heard an interview yesterday, they were saying that ang ginagawa ng mga motorcycle riders, naka-focus daw sila dun sa kanilang nakikita sa daan, imbis na dun sa kaharap nila. Kaya it becomes an accident. It turns into an accident.
Well, that's very possible, Pinky, and I myself, I encountered that, and in fact, I would like to, if there's a chance, a hearing, probably the budget, because some of our roads, I do not see the rationale why DPWH in their drainage improvement. Instead, before it was used to be in the sidewalks, andun yung drainage, and then the sidewalk now. They use the road. I don't know if it's a shortcut. And it's not, you're right that sometimes it's uneven. You might cover in the manholes, in the drainages, sometimes nakausli. And if you're a motorcycle rider, you only have two wheels.
Yeah.
You can't blame them for trying to...
kakabig sa kaliwa o sa kanan
at kanan yan eh. So ako rin because I bike also. Especially for bicycles, it's more sensitive, no?
Yeah.
So, yun, we need to improve the roads right now, especially in the metropolis, no? Ang ano rito eh. That's why I'm pushing for a master plan na talagang dapat tuloy-tuloy. And we have to improve we have safe pathways, safe roadways. We have to push for that.
How can you even start with EDSA? Again, sir, good idea. You know, do your part. Let's do our part. Mag-seminar yung mga bago bumili ng motor. Pero paano naman yung responsibilidad ng gobyerno
That is
dito?
correct. That is correct.
Don't we deserve a better EDSA, for example?
That is
And in
correct.
fact, let me also add that it's quite confusing. The right side of EDSA is supposed to be for bikes. Saan ba talaga ang mga motor?
Well, there's a proposal to have a dedicated motorcycle lane. Now that it is being implemented in the Commonwealth area for experimental, it's on an experimental basis. If it becomes successful, then I think they will try to put it to implement it also along EDSA. So there is some protest in some motorcycle groups.
There.
But whatever would be better for safety, I think we just have to accept it.
But master plan, sir, I mean, do we need international consultants to be able to tell us how EDSA will work? I hope you understand. I mean, it's quite disappointing that this has happened for so many years. And then because of the pandemic, people were forced to buy bikes.
Yes.
But it doesn't seem like, although, I know in some areas, binibigyan naman sila ng halaga. Pero ang hirap po talaga. I mean, let's call a spade a spade. Ilang lanes ba talaga ang EDSA? And then that, nagsasama-sama at one point. Meron ba talagang chance na magkaroon ng bike lane at meron ba talagang chance na magkaroon ng lane for motorcycles?
That's the thing, Vicky, because our roads are narrower, and it was not really designed for bike lanes. And it only came about during pandemic, when people a lot of people used bicycles and motorcycles. But personally, I think EDSA, since the MRT is there, the buses are there, the bike lane should be confined in the secondary roads. Because I bike to work. I bike to work almost Monday to Wednesday.
Yeah.
So I don't use EDSA because it's there's too many cars, the fumes,
The pollution.
The pollution. So the logic of having a bike lane along EDSA was during the pandemic because a lot of people were using the bicycles. Now that the MRT is back to normal, the buses are there, other transportation, public utility vehicles, I think that the bicycle lanes, although I'm a biker, should be confined to the secondary streets.
So
that's
not
another
anymore.
lane.
Yeah.
That's another lane. Example.
So, sorry, sir.
Yes.
So if you want to move the bike lanes to the secondary roads, are you proposing that let's say EDSA, the rightmost lane, be dedicated to motorcycles? Is that what you're saying?
Well, because probably we can experiment on you can give them time probably for rush hours. You can let people who are on bikes use the bike lane. But I talked to Kuya Kim nga one time. Sabi niya, sayang, during certain times of the day, you have 500 cars in the main road and then there's only 5 bicycles using the bike lane. Sayang yung lane. So these are the things that we really have to balance right now, on which will be more safer and more practical, since we are already almost in the pre-pandemic levels when you talk about the traffic. So because the bicycle lane already occupy one lane.
Yeah.
So
yeah.
probably bicycles and motorcycles can use the rightmost. They
One
can share.
lane, no?
So
Yeah.
it will be safer also that they don't go weaving out.
Yeah, pero that lane, Senator, yung nakikita natin ngayon, again, yun.
Yeah.
Kita mo yung...
Supposed to be bicycle lane.
Opo. Yung iba may green.
Yeah.
Yung iba wala. Hindi ko po maintindihan Tapos may drawing po yan
Yes.
That actually, to me, doesn't look like... I mean, you have to question, what is that drawing? Is that...
It's a bicycle supposedly with a...
Was it clear to you?
Sometimes it looks like an insect, but
Hindi ho ba? So, ayan yan yung mga manhole, yung mga...
well, there's too many potholes. I'm hoping that...
It's not safe.
Yes, it's not. That's why I don't pass EDSA going to work. I use the secondary roads. Hopefully in the budget season, Pinky, I would
What would you do,
ask
sir?
the DPWH, MMDA, that they have to improve EDSA because it's just the main artery. It's the main road. And look at the motorcycles, they are bouncing, because of the road condition. But I am also already seeing improvements, but patsi-patsi, kumbaga, it has
But
to
sir,
be
yung
the whole
patsi-patsi
thing.
nga, yun nangyayaring pagpatsi po nila, bigla na lang lulundag yung,
That is
yung
correct.
sasakyan mo, yung motor mo, o yung bicycle mo. Alright.
And, what I really observe, Pinky, is the drainage system. I don't
Yeah.
know if it's a shortcut. It should be on the sidewalk.
Let
And
us
then
know what they say, sir.
I would ask. Yes,
During the
I would.
budget season, and please commit to having a better, our major roads, an
Safer.
improvement and safer for all of us. We need to take a very short break. We will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Senate Deputy Majority Leader J.V. Ejercito. Now, let's talk about the Universal Health Care Law. You want amendments to this? This is part of your priority bill. Sir, first of all, let's just go back. Di ba dapat magkakaroon ng increase sa PhilHealth contributions?
Premiums. Yes.
Sa premiums?
By law, yes.
By law. In fact, every year,
Yes.
henceforth. However, you were calling for the suspension of this
Yes.
in 2022. The president also said no increase
increases.
just yet. The question now is it inevitable that in 2023, in 2023 or 2024, tataasan na po yung premium?
Well, actually, Pinky, being the principal sponsor and author of this measure, all of this data, all of these numbers underwent study based on the prevailing situation at the time that we were drafting the Universal Healthcare Law. But we didn't know that, or didn't expect that there would be a pandemic. Nobody really foresaw that coming. So, of course, everybody, the economy was way better, pre-pandemic levels. Everybody was earning very well.
Yeah.
So, the premium contributions were based on that prevailing situation at that time that people can afford because things were so much better back then. But when pandemic struck, of course, economy, lockdowns, economy was hit hard, uncertainty, people lost their jobs or there were pay cuts. So it's understandable that a lot of people were struggling to pay a lot of things, bills, and even the contributions. So President Duterte back then ordered the suspension of the premium rate hikes, and which was carried over when President Bongbong Marcos took over because we are still recovering from the effects of pandemic. He also issued an executive order suspending the premium hikes. Now that, being the principal
So
sponsor.
twice na siyang nasuspend,
Yes.
just to recall, in 2022 and 2023.
Yes,
Okay.
that is correct. Now that I am back in the Senate, even though I'm the principal sponsor and author, we have to make the necessary adjustments and adapt to the current situation. No law is perfect. That's why, Pinky, after a year, you can really make amendments. And now that I'm proposing an amendment to adjust the premium contributions, there will be hike every year, but we will now go back to pre-pandemic levels. So, for example, that by law this year, dapat nasa 4.5 na, 4% ang contribution. We will go back to 3% to much more affordable for all workers, even OFWs. I think everybody will be very happy because based on our on our amendments, it will be more affordable and the increase will be very gradual.
So, what can we expect in 2024? Tama ho ba?
Yes.
Okay.
We will go back to when the law was
Formula.
first implemented. Yeah, so kumbaga i-atras lang natin so to be able to let everyone recover first, the economy and everybody else.
Yeah, so in 2024, are we expecting an increase in premiums for PhilHealth?
There's a table that I think it will increase by 0.5% every year.
0.5.
0.5
Okay.
if I'm not mistaken, yes.
Okay.
But
So,
we will go back to, I think 3%. Go back to the original rate by next year.
so 3%
Yes.
by 2024.
Yeah, supposedly 4.5 na yun, or 5. So we go back to, I think 3, if I'm not mistaken.
Yeah, balikan natin yan. I guess it'll either be 3 or 3.5,
Yes.
no? All right. Any other amendments to the universal healthcare law, sir?
Well, now that, that's the main amendment.
Okay.
The contributions,
Yeah.
especially for OFWs. So we addressed their concerns. We consulted everyone, the stakeholders, and I think they will be very happy. And they are already actually, we have consulted the Secretary of the Department of Migrant Workers and other stakeholders. And I think the premium rates that we are now proposing under the amendment will be very, very acceptable and very light.
And what is that for them?
I think it's, I forgot the numbers, Pinky, but
So there
it's
was
very,
a proposal
very, yes.
for a certain amount,
Yes.
a certain percentage for all
It's based on the salary,
OFWs.
based on the salary base.
I
Now,
see.
we adjusted based on the minimum. So it's really, it's really very minimal. I think 1,000 or even less. And it will, for the OFWs, kasi sabi nila,
Wala naman kami dyan eh.
Wala naman kami dyan, but it's all their family members are now insured. So, for example, they get sick, they get hospitalized, hindi niya kayo problema na magpadala rito because the PhilHealth will now cover everyone, including your family members who are here in the country.
I know. I do remember that argument, Senator, that they were saying that can't it be voluntary? Wala naman kami dyan sa Pilipinas. And then the argument of government was, it's not just for you, it's for your whole family to secure your family. So the issue on it being voluntary or not, hindi na po yan pag-uusapan.
Well, we will,
mandatory ho ba?
it will still go through a debate, we'll still go to the plenary, then we will see, what the outcome will be. We'll still, it will still go under scrutiny, but based right now, I think it's very minimal, Pinky. I don't have the figures on my head. Medyo mahina ako sa math, pero but as far as I can remember, it's very, very it will be very light for them.
Yeah, yes. And it's mandatory, obviously, for OFWs. All right. So, are there going to be increases in the coverage of PhilHealth once an increase in premium takes effect next year?
Oh, definitely, Pinky. The Z packages or the complicated disease, for example, for heart operations, open heart surgery, you can get as high as 500,000 pesos. For renal or kidney operations, transplant, as high as 600,000 pesos.
Dialysis, sir.
For dialysis, before it was 93 sessions a year. We increased it to 120. Now it's even 140. So, and breast cancer, I think 150 to 200,000. So, for COVID cases, for severe pneumonia, for example, you can get as high as 300,000. So, we have quite, we have improved and leveled up the packages.
So that has happened actually in the past, because I do remember that the dialysis, if I'm not mistaken, was already increased because of this universal healthcare law. Are there any plans even for government to subsidize PhilHealth, if any at all?
Well, PhilHealth we have to really improve the financial capability of PhilHealth to make sure that, because we have no choice, because universal healthcare law is very dependent on PhilHealth as the only agency to implement this program. And I'm hoping that this time around it will we will have better management. It's that's why I was
pushing for the kind of leadership that PhilHealth should have. Sabi mo dapat financial
expert with actuarial knowledge. Hindi naman, I'm not undermining the capabilities of doctors, but PhilHealth is more of a financial management company with actuarial, kumbaga insurance to actuarial, dapat actuarial background.
Okay. All right. We need to talk about what happened during the Senate hearing yesterday. It was postponed on this alleged sugar smuggling, but we need to take a very short break. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Senate Deputy Majority Leader J.V. Ejercito. Sir, what happened yesterday? No show. Si Yusek Panganiban. Tama ba?
Yes. Pinky, it was the first day back in session after our break, no? And I was, of course, excited to get back to work. And yun nga, yung first hearing, at 9 o'clock. And I was really surprised that Yusek Panganiban, will be very vital in this probe, being the head of Department of Agriculture, was not there for the second time already.
Yeah.
Even Executive Secretary Lucas Bersamin, we know how busy he is. He was there. The whole Bureau of Customs, the top officials were there. DTI were represented. The sugar industry stakeholders were there.
Yeah.
And there are about 4 or 5 senators that were present. So, and Senator Tolentino, the chair of the Blue Ribbon Committee, better to postpone it because hindi namin matatahi lahat no? The chronological events of
Without
what happened.
Yusek Panganiban.
Without Yusek Panganiban. There are questions that are
He's vital in
issues
the
that he
hearing,
will be vital.
And were you guys not told that he was not going to show up?
I was not told, and I didn't have information, so I was really surprised. When I sat down, I saw Second ES there, the BOC officials. I was looking for him. No? And the only one I saw was from DA, is Assistant Secretary James Layug. And
Okay.
I'm sure that he will not be able to answer certain issues and questions which should be better be addressed by the Yusek Panganiban.
And why wasn't he there?
Well, according to them, that he is on an official trip
Right.
in the U.S. The probe, he was also on an official mission somewhere else. So, this is the Blue Ribbon Committee, Pinky. And
And how do you feel about that? That this is the second time that it's been a no-show. He
Of
hasn't.
course, we're not happy because, the Blue Ribbon is for public accountability of government officials. It is very important for us to get to the bottom of any scandals. And it's really disappointing that Yusek Panganiban didn't come for the second time.
Do you think do you think it's intentional?
But I hope not. But I think if the chair, Senator Francis, would issue a subpoena, then I would support because this is already the third time,
Yeah, if ever.
if ever.
So for you, is it time to subpoena him?
I think it is because, because of that, he is wasting a lot of time of a lot of people, no? Not only the senators, executive secretary, some officials, BOC officials were there, stakeholders. So that's
And because of his absence, hindi natuloy yung hearing.
yes, we were not able to achieve anything.
All right, very quickly, sir. I read something that you wanted that's electronic travel cards scrapped. Tell us why.
Well, it's the WHO already issued that already declared that the pandemic is over. No? So parang
Global health emergency.
Global health emergency is over. And Vicky, I got a chance to travel to Europe, to Japan. All they ask for is Vax card. No? Sometimes they don't even ask. And it's like normal already to them. And here I coming back. I almost missed my flight when I was in Milan last year because I was having problems registering in that e-pass or whatever,
E-travel.
e-health travel, coming to the country, and they won't let you board unless you are able to register.
Yeah.
And then coming back, when I was finally, I was able to register at 30 minutes before the flight. Coming back, you will see, it's not a good impression because before the immigration, there's another
line
booth.
for that,
There's another line manned by Coast Guard, people in fatigues. So it doesn't give you a good impression, especially for foreigners and tourists.
So it's time to end that.
I would think so because the WHO already declared that the crisis, the world health emergency is over.
Yeah.
So I think a simple Vax card would be more than enough.
All right. Very quickly, sir, I noticed also some tweets you had about San Juan. Ito pong Andres Bonifacio and yung monumento. The Jacinto and Bonifacio monuments. What happened? What's going on there?
Well, Piki, I was coming home one Sunday evening from Mass, and the Andres Bonifacio Monument is very prominent. It's in the corner of along Pinaglabanan Street. pinaglaban the history of San Juan, the first Battle of the Katipunan happened. Kaya nga pinaglabanan yan. The first Battle of the Katipunan happened in the Battle of San Juan del Monte. So when I became mayor in 2001, since that's the strength of the city of San Juan, I pushed for having monuments of Bonifacio to honor our hero, and that's the pride of our city,
Yeah.
right? So we had Andres Bonifacio, Emilio Jacinto, and then Jose Rizal.
Wait, so kayo nagpagawa nun?
Yes, it's
Okay,
the local
alright.
government.
Okay.
And then to add to that, as our contribution to strengthen nationalism, that's, I think, you have to be realistic about it. Medyo kulang na yan eh. And I'm hoping that we will be able to contribute at least
Okay.
and strengthen the love for country, patriotism to this.
So what happened? Did it, anong po nangyari?
Nagulat na lang ako pagdaan ko. One day, it was dark. Pagtingin ko, wala na si Bonifacio. No? Nakakaawa naman, niligpit na nga si Bonifacio nung panahon niya, niligpit siya, pinatay. Ngayon, pati yung monumento, niligpit din. So, it was already, rubbles already. And I was really,
Sino
I felt sad.
Si Mayor? Is that so? It has to be the LGU, right?
Well, it was the LGU that they wanted to transfer it to inside the shrine.
I see.
And they said that it was, they had the blessing of the National Historical Commission so that all these monuments will be together. Pero Pinky, the Pinaglabanan Shrine has already one shrine that is prominent, in Spirit of 1896. That was built during my father's time when he was mayor in 1972.
Okay.
And, Pinky, Pinaglabanan is very, very, it's a sacred ground. That's where the first battle happened. So we really wanted to give
Highlight that. Yeah.
because in other countries, landmarks they really give
Prominence, importance,
to their heroism.
Tapos
to
marami
battles.
nagpapapicture doon.
And
Okay.
every time people will pass, lalo na yung mga youth natin,
May kita.
dito pala yung pinaglaban. They will feel a strength, some sort of
Pride. Right.
And even the Museo ng Katipunan, Pinky, that is located there, that's our dedication to the Katipuneros and Andres Bonifacio. So, sa akin lang sana, wag naman pati yung hero natin, no? Naligpit ta. Niligpit na nga noon, niligpit pa ngayon.
Senate Deputy Majority Leader J.V. Ejercito. Sir, thank you so much for your time. I hope to have you again. Take care. And CNN Philippines will also reach out to San Juan Mayor Francis Zamora to comment on the issue on the monuments. I'm sure we'll be able to speak to him as well. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.